So we take care of shoulders a lot here at the practice, and one of the big ones that always deal with the shoulders are going to be the rotator cuff. Most people are always focused on the rotator cuff when they have shoulder issues. That is not always the case, but many times it can be. And you could potentially have rotator cuff tears. Now, one thing about rotator cuff tears are there are a multitude of degrees of cuff tears, and there are 4 muscles within that, muscle groups within the rotator cuff. So there's a lot of things that can go down. So the good thing is, though, is if you have a grade 1 or maybe even a grade 2 tear, you can still do just fine with some rehabilitative therapy, some physical therapy, some hands-on conservative care. You may need to do, like we'll do things like PRP into muscle belly, etc., to try to help with some of the tearing, etc., to try to help to stimulate healing and repair of that issue. But there's a lot that can be done. Really until you have just a very, very severe tear. And most of the times you can tell what those are because you've already lost a lot of mobility and strength, not just due to pain, but just strength in general. And so just making sure that the right type of diagnostic decisions are made. Also, too, conservative care is attempted because many times through conservative care that you can fix a lot of those rotator cuff issues, also too with the right type of therapy, because if all you're doing is just going in and trying to get after that problem and never truly correcting the issue that caused the rotator cuff tear in the first place, you're just going to continue to tear it. And then you may end up with, just from a primary, like a first degree tear to, you could just over time, because you're never truly fixing the problem, you're only treating the pain, then you eventually end up with like a second degree tear, a third degree tear, because it was never truly looked at correctly. So fix the biomechanics, even if it's early, because if you can fix it and help to heal the tissue with things like PRP, etc., you're going to get so much longer life out of that shoulder than just going in and getting a steroid into that and just letting it break down and ended up into that, into the second degree, third degree tears, which may end up having to be surgical. So take the time, do it right, get it rehabbed correctly, so that way you can prevent a lot of things